I'm Dr. Karen Sutton, orthopedic surgeon in sports medicine at Hospital for Special Surgery and on the research committee for AOSSM. I'd like to take a moment to tackle some COVID-19 questions. First, I'd like to thank those physicians who are treating the severely ill patients. This is a very difficult time for sports medicine surgeons and team physicians, but we must continue to reassure our athletes, coaches, athletic trainers, and help to answer some questions. The first question, which will be posed by AOSSM members: how can I stay calm and cope with the stress and anxiety regarding COVID-19? The first I would say is take control. Know how your body responds to the stress and act accordingly. Are you having muscle tension, decreased ability to sleep? And then pause for a minute, address those symptoms, think about something positive, or name the 17 muscles that attach to the scapula and get your brain to a neutral space. Second question, what are team physicians encouraging athletes to do during this time? Certainly wash your hands and don't touch your face. Listen to the public health authorities. This varies from state to state and country to country, so it's important to keep up to date. Two great resources are the WHO and the CDC, and they're continuing to produce interviews, video, information daily. Third question, do you have any suggestions for athletes that have had surgery postponed? Communication is key. I'd say to talk to those athletes directly and personally and give them the information. Why are we postponing the surgery? Why is this important? Use it as a moment to talk about social distancing. The patients will want to know what they can do during this time. Athletes are always active and they'll want something that they can positively do to help their body. I'd work with your trainers and physical therapists, give them resources to the patients, what they can do from a video standpoint. Our hospital specifically is putting together PDFs that we're distributing to the patients because they're undergoing a longer prehabilitation for ACL surgeries. So try to distribute information to those patients. Fourth question, what are a few ways to stay motivated or athletically during this quarantine time? A couple things that have helped me, setting a schedule and really trying to stick to it, as well as making a space for you to exercise, whether that's inside or outside. I prefer the outdoor workouts because I do enjoy getting the sun, fresh air. I think that helps during this time of stress. And look into these stay-at-home challenges. People are giving over squat challenges, push-up challenges, even soccer juggling challenges, which I won't attempt. But it's a fun way to stay connected and get a good laugh, even if it doesn't have an amazing workout, but it'll get you moving. Last question, do you think there are any benefits to COVID-19 athletically or perhaps? Well, I hope we never experience COVID-19, but if we do, it gives athletes a chance to readdress what they need to work on. It can give them a time to sleep and try to recover their body. You can also look at encouraging athletes to look at flexibility training, plyometric training, and mental wellness. The last thing I'd say is make sure you stay in touch with your colleagues. It's important to send them a video chat, some sort of messaging, give them a phone call, and make sure we're doing well for each other. So really try to stay in touch and call a colleague today.